Okay, everybody, we're going to get started. Welcome, everybody. We've had a break of about 3 months, so we are kicking off with a clinker now tonight. Going to welcome Dr. James Cooling. I met James through the rider-specific PT training that we did last year, and how James fits everything in, I've no idea. He's GP and also is an independent LANTRA Bit and Bridle consultant and a member of the Association of Professional Bit and Bridle Fit. I had the pleasure of working remotely with James this year with B. We had already had a session with Pippa Cairns, so we were able to work off her assessment, and then James was very kind and helped me select a couple of bits for B, which we are currently still using. Thank you. And we are
Good.
also hopefully going to maybe get a clinic organized over here, so we can have you over here in the flesh at some stage. James's webinar is entitled Bit and Bridle Fit for Welfare and Performance, and obviously the welfare is first in the title, and unfortunately our sport at the minute is under an awful lot of scrutiny, and I suppose if we can have any further info for ourselves to take forwards into our riding as far as the welfare of our horses is concerned, it's definitely going to be a positive step. So over to you, James, and thank you very much. We'll just make...
Okay. Have you made me host so I can share screen?
that.
Yeah, great. Thank you. So hopefully you can see my screen now. Can you just clarify that, Lisa? Yeah, great. So thank you for the introduction, and thank you for asking me to do the webinar tonight, and thank you for everybody listening that's tuned in. Hopefully it will be informative and happy to take any questions. So yeah, in terms of my background, I've done lots of things with horses, but I'm also a GP, as Lisa mentioned. So I have a bit of a different approach, perhaps maybe to other approaches in the past with bit and bridle fitting, and I do take a fairly clinical anatomical approach. And we do really focus on, as I said, on welfare and how that will improve the performance of your horse. So I'm going to talk through tonight how we approach it, different things about basic bitting, different different parts of the anatomy that are relevant, and hopefully make it all link up. So as Lisa mentioned, I work with the Association of Professional Bit and Bridle Fitters, and we work really to promote welfare and ethical practice in the fitting of and the use of bits and bridles. We do quite a lot of talks and things, hopefully increasing understanding amongst the equine industry, horse owners, and anybody that's interested in the physical and behavioural effects of bits and bridles. We only provide, apart from, I'm going to say, Lisa, we did do it remotely. Usually we provide an independent service. We don't sell anything. We don't work on commission. And we always see the individual horse and rider, preferably in the flesh. We do a few remote things, but we can help remotely, as shown. Ideally, we're looking to remove any sort of costly trial and error process. It is outdated these days, and it's if you're making errors, then it's potentially a welfare issue. We look at the whole horse because it affects the whole horse. Looking to improve the performance, the comfort, the communication, the control. So mainly not thinking about the bit just as simply brakes or steering. We're thinking about the more subtle effects of the bit and the bridle and how that can affect the whole biomechanics, which is why we look at the whole horse. And also obviously ensuring that we keep up to date with what's going on in the industry, and we'll talk about some of the research that's been published this week a bit later on, actually. So again, we're going to start off with looking at the whole horse and what things the bit and bridle can affect. Obviously physical effects, obviously behavioural effects. Bitting problems, bitting issues can present with dental issues, oral behaviours, problems with tension of the TMJ. Your physio may, or pyrophone problems. Tongue problems are obvious, and we get asked to see lots of horses with tongue issues, tongue out, tongue being drawn back, putting the tongue over the bit. Head shaking issues can be related to bit and bridle fit, trigeminal pain, and trigeminal issues, particularly with bridle fit. Again, thinking about biomechanics, poor musculoskeletal development, apparent lameness, bridle lameness, issues literally can be related to things as simple as the headpiece fit. And again, I'll go into more detail about that a bit later on. Obviously, behavioural effects. I always like to see the horse completely untapped first if I'm assessing a horse, because I want to see the horse's reaction to the approach of the bit and bridle. Really, does it go and run to that? Does it hide in the back of the stable? That's telling me something about what the horse is thinking about either being ridden or handled. Any sort of physical or psychological tension, any napping or evading, anything else really that you may have any other checks for, the usual checks, saddle fit, vet, physio, dentist, etc. Any of these things could be related to bit and bridle fit. The obvious things like contact problems, we're often asked to see, particularly with dressage horses, etc. And not remembering or not forgetting, horses are flight animals, 50 million years of evolution as flight animals. So other behavioural effects like strong horses or dangerous behaviour, horses running through the bit as in the picture. If you increase the tension, or the bit or the bridle is causing increased tension in the horse, you're going to increase the flight response. If you increase the flight response and the thing you're stopping the horse with is causing the problem, you're going to increase the flight response. And so it becomes a negative cycle. So again, addressing that can make a massive difference to the horse's safety and the rider's safety. So again, just looking at a few of these pictures here. Again, this picture in the top corner, this is a tongue issue. There's hardly any room for this bit. This horse here, again with the rollers, it's a traditional bit with rollers on, supposed to stop the horse grabbing the bit. This is going to cause pinching of the fleshy lips of this horse. It's going to cause problems. This is a Spanish horse I was asked to see that had persistent tongue issues. It would do this all the time. It had quite a lot of facial asymmetry actually when we looked at it, and it had come from Spain, and it actually had some nerve damage that was causing the problem at the end. It wasn't a bitting problem, but we were able to eliminate bit or bridle fit as an issue during the assessment, and it ended up going back to the vets. So again, a little bit about where we are today with bit and bridle and social license considerations as well, which I'm going to mention. We have been using bits for thousands of years, and the designs haven't changed massively until recent years. This is a medieval bit at the top. Looks like pretty much any snaffle that you might see in the tack shop today. Recent traditional approach, certainly in the UK and Ireland and Europe, really developed from military rules. And the BHS manual, etc., came from military rules, where we get a lot of our apparent rules from. But the development has improved in recent years, and there's been a lot of new designs. But some bits will cause conflicting signals, which we try and avoid. And as I said, again, adopting trial and error really isn't going to help. There's also problems with bitless bridle designs as well. These have been shown to cause really high pressures on the nose and the jaw at times. And again, there's independent studies that have proved that. So they're not necessarily better than bits, but they cause pressure somewhere. So as long as you're aware of what pressure you're causing and what your horse prefers, then that's fine. But the awareness is the important thing. So as we do, the assessment of the individual horse really is the most effective thing. So one thing I want you to take away, if nothing else from this, is ideally bit and bridle fit should be approached really as most people do with saddles now, and that it should be fitted to the individual horse every time. This picture is from the last Olympics. It's the pentathlon horse that was caused a lot of outrage, but I'm going to say this is from a bit and bridle point of view, this is pretty much a disaster in terms of what's going on here for the horse, and not surprising they really couldn't communicate clearly. We've got a Cheltenham gag that has conflicting signals. It gives a lifting action while causing pole pressure, so we're asking the horse to lower. We've got a flash noseband, which has been shown to cause highest pressures, so therefore stopping the horse from doing anything to avoid the conflicting signals. These pretty bonnets have been shown to cause really high pressures just above the TMJ. The more braided and attractive they are, the more pressure they cause. So again, we're giving the horse a headache here, as well as having the buckles digging into the TMJ. So there's all sorts of things going on here. In addition, a running martingale to stop the horse lifting the head while the bit's telling the horse to lift its head. So from a bit and bridle point of view, that's although a fairly common setup to see, really not a helpful setup when you think about what signals you're trying to give to the horse. So these sorts of things really need addressing. And we'd be encouraging, obviously, consistent rules across all sports, and governing bodies, really. So, but we'll talk a bit more about basic stuff now, basic bitting, size and fit, where to put it. And that really depends, again, I'm going to say that depends mainly on the horse's anatomy. And that's one of the things that we'll talk about in a bit more detail as we go through this. So you can see here in this picture, we've got the side-on picture of the horse's mouth. You can see the tongue. You can see this part of the tongue, which is called the torus. All horses have this, which is the raise in the horse's tongue muscle. And you can see the grooves on the palate quite clearly. Let me just go back to that. So again, we'll be looking in the horse's mouth to see what's going on in there, and that's where we fit the bit will depend on the horse's anatomy. Again, picture of a bit fitted. This is a French link, a traditional French link with a plate. You can see here actually the plate lays on the thin edge, the traditional French link, and you can see here the thickness and the weight of this bit is putting quite a lot of pressure on the horse's tongue already. But in terms of where it's positioned in the mouth, it's avoiding the canines. It's not causing too much pressure on the lips, and it's not in the premolars. So in terms of position, it's optimized in position probably in that horse's mouth at the moment. The final picture, again, clearly this bit's too big for the horse. It's been lifted too high in the mouth. It's without any rein contact, it's already pulled through. This bulge here is the teeth, so the bit is already sitting in the horse's teeth, which is not ideal. This horse is likely to be chewing the bit, grabbing the bit, opening the mouth, holding the bit, leaning on the bit, or any of the above, to try and manage this contact that's already there just from where the bit's fitted because it's too big. And again, just looking at the bridle up there, the buckle sitting on the TMJ, the temporomandibular joint. So that metal's digging into the side of the joint there. So we'd ideally want to avoid that. So there's a few things here, again, that are clearly showing issues, and are fairly easy to address, really. In terms of sizing, always asked, how do you measure? And I'm going to say it's difficult because different bits will fit differently in different horses' mouths. So in different manufacturers and different designs will come up different in fit. So although you may measure your horse's mouth as a 5-inch, it may not be a 5-inch depending on what manufacturer you use and what design of bit you use and how it fits in with your individual horse's anatomy. So be prepared to have a look, and go bigger or smaller depending on what your horse needs. So we'll talk a little bit about the classification of some common bits, which I'm sure people are aware of. But just to clarify some things, your snaffle obviously is a direct acting bit. It has an elevating effect, and there's thousands and thousands of different options of snaffles these days, which is why it's becoming so difficult to find one potentially that suits your horse. It acts on the tongue, the bars, the lips, corners of the mouth, and possibly the sides and the cheeks, depending on the ring action. Leverage bits, anything with a shank below the mouthpiece, essentially is a leverage bit. They create varying degrees of pole pressure depending on how your rein is set up, and they have an indirect action, basically. So your rein tension will not match the tension that is in the horse's mouth. That's the simple physics. The lever increases pressure at one end. So while it may feel easier for the rider, it's the horse is getting more pressure at the other end usually. And again, these can either be a sliding lever like in this picture where the mouthpiece slides, or they can be a fixed lever. And again, that will have varying action, varying pressures in different areas on the horse. The true gag has a lifting action, like your Cheltenham gag, where the bit will run up the cheek pieces, ideally to use with two reins. You should have a snaffle rein on here, so you can separate that action for the horse. But often not used like that. They do exert some pressure on the pole, but not as much pressure as you would usually think. In terms of a curb bit or a Weymouth, usually the Weymouth, obviously part of a double bridle, used along with the Bridoon or the snaffle part of a double bridle. They have a lowering and rounding effect due to the curb action. They should increase collection, stretching over the back. The curb should be adjusted, as in the picture, to 45 degrees, so the shank doesn't pass more than 45 degrees in relation to the horse's mouth. Again, often you'll see these misfitted, where the shank is rotated much further, to almost to 90 degrees in relation to the horse's mouth. Again, people sometimes think they're being kinder by not having the curb chain too tight, and allowing that shank to rotate further, but that just increases pole pressure. The further the shank rotates, the more pole pressure you get. So having the bit balanced correctly also will make it act in the way it's been designed in the horse's mouth, and also it balances the pressures between the pole and the chin groove. So that's important to manage. Pelham, again, obviously, is designed to try and combine the effects of a double bridle with one mouthpiece. So a lot of horses have very little room in the mouth, and so fitting two bits into the mouth can be difficult. Again, ideally used with two reins. If you're using it with roundings and a single rein, you've effectively got the curb in action most of the time, and your curb effectively has a braking effect, and will slow the horse down. So if you've got your curb acting all the time, you've potentially lost your brakes, because the horse has to ignore it first to go forward, but you then to reapply it. So again, it can be a bit conflicting in terms of the horse's understanding. And again, so some general actions of all bits on rein contact. And again, this is from the ridden position. And the rotation and the action of the bit will change depending on the rein angle, where you are, whether you're sat on the horse, whether you're leading the horse, and where you put the angle of your hands. So if you see riders that will either raise their hands very high or lower the hands wide or low, again, that will change the action of the bit, either onto the bars or more into the corners of the mouth if you lift it. But in general, bits will rotate and move backwards along the tongue towards the premolars. And there's been quite a number of X-ray studies as well, looking at how different bits will rotate on rein contact, average rein contact from the direction of the rider. So really in this sort of position that we see in the picture here. Some bits which are pretty common, like your single joint snaffles, your double jointed snaffles, KK Ultras, which is a Sprenger bit, can rotate almost and translate almost an inch in a horse's mouth on rein contact. So from where you actually fit it to where it ends up can be completely different. Other bits, things like miler bits or barrel design bits, often called comfort barrel bits, are much more stable in the mouth on X-ray studies and will only move a couple of mil actually. So they can have their advantages if you need stability, or if the horse has little room in the mouth. All bits will compress the lip and the tongue, depending on the bit design, depending on the size of the tongue. And as they do rotate and move in the mouth, they'll generally reduce pre-tension on the poll. So that's the tension down the cheek pieces. So actually poll pressure is less than is usually thought, and that has been measured by a number of companies. All single and double jointed bits, almost all of them, have a potential to close around the jaw, so what you might call the nutcracker action. It's not just single jointed bits, although again the angles of how that affects the horse and how much jaw pressure they create or around the lower jaw depends on the bit design, and also depends on the width of the horse's jaw at the end of the day. Double jointed bits still have that closing action. The bits usually pulled away from the palate, so again, one of the common concerns with single joint bits particularly is it going to hit the roof of the horse's mouth? And actually from this rein angle they don't, basically. And again, that's been shown in X-ray studies, even with quite thick single joints, traditional single joints. As you pick up the rein, it rotates and moves upwards and backwards away from the palate, so it's actually very difficult for that to happen. Poll pressure, as we said, is generally lower, and this has been measured. But there is also some bits now, quite a lot of bits now, that are designed to engage in a particular rotation on rein contact. And some companies design their bits specifically to do this. Two of the common companies, Referral, which is a British company, and very popular, design their bits to come into what they call a working angle on rein contact. So they will rotate and change position and change angle. So again, whether the bit design is able to come into that working angle partly depends on how you take your rein contact, and also depends on the horse's mouth anatomy, whether it has room for that change to occur, which will, if it doesn't, the bit won't work in the way it's designed to work, in which case it's probably not going to be suitable for that horse. Springer bits also create different angles on their mouthpieces, and again, they often rotate in an entirely different way to newer shore bits, and their design process is quite different into how they design the mouthpiece and the action. So again, which will fit some anatomies and some mouths of horses better than others. So again, if unless you have an understanding of the engineering of the mouthpiece and how they're designed to work with these more complicated snaffles, then again you can easily get into a bit of difficulty with them not working in the way they're designed to work. So as we said, potential for huge variation depending on how one mouthpiece interacts with one particular horse. So again, it's very individual. Ideally, you really need to look at the horse in front of you. So how do you select a bit when there's all this going on? It's difficult. But we always start with the mouthpiece, or I always start with the mouthpiece basically, and the mouthpiece is always for the horse. They're wearing it, it's in their mouth. They've got to be comfortable. It's as simple as that. And so we do a full assessment of the anatomy, and I'll go through again a bit later how we do that in more detail, and the relative positions of the anatomy to work out what's going to fit comfortably within the horse's mouth. By comfortably, I mean the things that you need to consider, and the functions of the mouth, the functions of the tongue need to be able to work normally, even with a bit in the horse's. Even with the bit in, the horse needs to be able to chew, swallow, relax its tongue, yawn, move its jaw, etc. Even with a bit in, if it's going to be comfortable. So lots and lots of different materials, lots of different weights and different materials, and simply in some horses, just the weight of the bit it can be causing too much pressure on the poll, just hanging off the cheek pieces, or equally on the tongue and compressing the tongue if it's a thick bit or a very heavy bit. How the links and joints work, again, will have a massive difference and a massive influence on how the horse responds to it. The thickness of it, thick bits, thin bits, what actually fits, what available space have you got in the horse's mouth. Thermal conductivity is often promoted these days by some of the companies. What they mean by that is how quickly the mouthpiece heats up to the horse's mouth. The copper alloys reportedly heat up quicker than your traditional stainless steel and things, but we're talking probably seconds more than anything. So whether that's significant, I'm not sure. Metals that be synthetic, obviously. The issues with synthetic bits often is the quality of the mouthpiece, and they're easily damaged. So again, making sure that you're not getting sharp points or sharp marks on them, or the horse is chewing them, which can again cause injuries. I'm going to say simply, does it look anatomical? Does it look like it's going to fit? Because some designs just don't look like they're designed to go in a horse's mouth when you look at them. So that's a sort of a fairly gut feeling there. But yeah, some things just don't look like they're designed to go in a horse's mouth. So if that's the case, then I would generally avoid it. But just having a look at a few of these designs up here, so shall we say, some fairly simple snaffle mouthpieces that you might see. This is a Bomber one. Bomber, a South African company. They make bits out of sweet iron and stainless steel that they forged together. All their bits are made individually, by hand. So there will be some variation in them. There's quite a lot of fakes on the market, and you know it's a fake if they don't oxidize and the blue just rubs off. So that's something to watch out for if you're looking at for a Bomber bit. This is a single joint with a lock-up design on it, so it becomes almost like a mullen mouth, and it becomes more stable in the horse's mouth. These two pretty common looking newer shore double jointed bits, the third and the fourth one down. The main difference here really is how the cannon, the arm of the bit, the lozenge, the centerpiece, is linked. You can see they're linked at opposite angles. So the question is, why is that, and what difference is that going to have on the horse? I'm going to say this one here, the third one down, is always going to be more comfortable for the horse than the fourth one. When this is hanging on the cheek pieces, these cannons, these loops are going to lie flat across the horse's tongue, and the lozenge is going to give you the central pressure on the horse's tongue. And that lozenge is much more rounded and has a much nicer bearing surface than the end of the loops. This bit, again, is designed to come into a working angle. When it's hanging on the cheek pieces and when you open the horse's mouth and look, you'll find that these loops will be digging in to the lateral edges of the tongue and potentially the bars, essentially. So that is never going to be comfortable for the horse unless it can rotate into its working angle, in which case it's supposed to rotate up in the mouth, so these loops are laying flat. That will depend on the room that your horse has got in the mouth and how you pick up the reins and your rein tension and rein angle, whether that happens or not. So to be on the safe side for your horse, this one is always going to be a better design for them. If you want a sharp action, you're going to get a sharp action off that. But you may not necessarily want to create a sharp action if you're creating tension. This is one of their other bits. It's actually upside down, just to demonstrate how the back of the bit is curved. It's the turtle top design, which is an angle design. It's quite a clever design, but again, it's been flattened. The bearing surface has been widened, so you have a wide bearing surface. You get around the thick, shall we say, the thick bit or thin bit argument. The thick bit has a wide bearing surface, but it takes up not very much room in the horse's mouth because they've squashed it flat, essentially. An angle there, so it sits flat across the horse's tongue. But again, that depends on your horse's anatomy and assuming that you can get it into the working angle, which may or may not be the case. So again, if you have a turtle top or a turtle tassitail, which are both fairly popular bits but do different things, this is the turtle top, which is one that's designed to give a fairly even bearing surface across the whole tongue and jaw. Then again, just have a look in and make sure it is sitting flat in the horse's mouth. And when you pick up the rein, ask somebody to have a look and make sure it's still sitting flat, and it's not rotated or locked up, because again, it will lock up and create quite a lot of pressure in various areas once it locks. So again, your ring choice, obviously. So your mouthpiece choice is vital. Your ring choice obviously then affects how the mouthpiece works and how it rotates in the mouth. Obviously, lots of different ring choices here, some of which are snaffles, some which aren't. I'm going to talk a little bit about the universal ring, which again is a pretty popular ring that people step up to, say if their horse is strong or if they've moved from a snaffle, they feel they need a bit more control. This on pressure testing, this particular ring creates more pressure with a single rein on the low ring than a Cheltenham gag in terms of pole pressure. They create about 50 to 60% pole pressure. Your obvious thing to do, which most people do if you're using a universal, your cheek piece goes on the top ring. That would be a snaffle ring. The obvious thing to do is just drop your rein down onto that ring. That's going from 0 pole pressure to about 50 to 60% pole pressure. It's a massive step. A massive change in action for the horse and pressure points. And as I say, it has been shown on testing to be stronger than a Cheltenham gag and things. So, and also gives a pretty conflicting signal, because as this ring rotates and the mouthpiece slides up the ring, this pulls forward, which is where you get your pole pressure from, but the mouthpiece lifts while the pole pressure is staying lower. So it gives the horse a conflicting signal. So again, what horses tend to do is back off and sit behind it. But again, that's not necessarily helpful for the biomechanics. If you need to use this sort of ring for certain disciplines, that's fine, but don't use it every day, because it's not going to help your horse develop correctly biomechanically probably over time. There is other options in terms of rein setups with these rings, which are worth considering. Either double reins, if you can use them, roundings, again, reduce the pole pressure to about 25 to 30%. If you use roundings and a back strap, and you can use a back strap on this cheek piece, which acts a bit like a curb, but sits a bit higher up on the chin or on the mandible. You essentially, because the back strap reduces the rotation on the ring, you can virtually zero the pole pressure, because you have essentially a curb action, you will increase your brakes. So you'll have more braking effect, but without pole pressure. So they can be set up very differently. So they are useful. But again, as long as you're aware of different setups and how they affect the pressure and what you're looking for. If again, particularly if your horse is pole sensitive or has pole issues, you'd want to avoid it, but you could use it in a way that doesn't increase pole pressure, but would increase your brakes if necessary. So lots of different things to consider with those. We'll move on. But the main thing to say, if the horse isn't comfortable and it's creating tension, you're going to have some sort of compensatory behavior or biomechanics. So I'm going to say a bit about the double bridle. Obviously, it's a combination of two bits. Again, pretty topical at the moment in terms of dressage and should double bridles be used or not. I have no problem as long as they're fitted and used correctly and the horse has room for them. So I'm not going to say they shouldn't be used, but they can and do cause problems if not. Obviously, the bradoon sits higher. The weymouth of the curb bit sits lower in the mouth. The curb chain, as we've said, should be adjusted to allow the shank to rotate to 45 degrees, and ideally you should have a lip strap to secure the curb and stabilize it, which again is often not seen these days. The main thing there is that the position and the action of the bits in the horse's mouth, they have to be able to separate. So again, you need to have a look in the mouth and look at how they're moving on rein contact in the mouth. Problems often occur when they're overlying. And I'm going to say problems, again, pretty topical at the moment, blue tongue and things like that. I've seen horses stood in the stable with a double bridle on where the tongue is blue, simply because the bits are overlying each other and compressing the tongue. And that's before they've even been picked up. The rein has been picked up. And I've seen that a number of times. So it's not, the blue tongue thing is not that uncommon in my experience if you look for it, unfortunately. But they need to be able to separate in the mouth, and the action needs to be able to separate. Again, otherwise you're not going to get clear rein and clear signal. Ideally, if the horse is going happily in your snaffle, keeping the bradoon design consistent with that will keep it, your basic aids consistent for the horse. Ideally, advanced horses and riders. What do we mean by advanced? That's a question for other people to answer. And ideally should be used for refinement of the age, shall we say, and not necessarily breaks. But the new research this week on double bridles that's been published has been flying around the social media today. A small study done with only a small number of horses, or elite horses as these things usually are, all done in trot and straight lines. It claims the double bridle showed lower nasal pressures in the noseband adjusted to two fingers over a snaffle bridle. Presumably this was something to do with the influence of the curb bit, because I can't see any other reason why it would be, because that's the only difference really. And they also measured that rein forces were less in the double bridle than in a snaffle bridle, in elite horses ridden in walk, trot and canter, elite GP horses in walk, trot and canter and collected paces they put in the study. Total rein force was less in the double bridle than the snaffle bridle, and total rein force was less on the curb bit than on the bradoon bit or on the snaffle. I'm going to say, why is that? And so they also stated, obviously, that greater forces were being applied by the snaffle. That was the conclusion in these particular elite horses on the oral structures. But what we've got to remember here, which I think they've not pointed out, is that, again, the rein tensioner goes on this ring, between the rein and the ring, and between the mouthpiece and the rein tension measuring tool, you've got a lever. So what you're measuring on the rein tension is not the same as what the horse is experiencing in the mouth, because levers increase pressure at the other end. So while they may have measured a lower rein tension over your snaffle, I'm not disputing that's what they did measure, that doesn't mean that that's not the pressure the horse is experiencing in the mouth. So we can't conclude from this study that double bridles are better than snaffle bridles, because we have a lever in the middle, and that's basic physics. So I'll moving on. We've said a few common questions, just a few common myths and things about how bits are usually fitted. The kind of 2-wrinkle rule, it's a military thing. It came through the military fitting, through the BHS manual in the UK. Again, this horse, it's got a couple of wrinkles there. I would say, fits the anatomy of the horse in front of you, basically. If your horse's premolars are low or very prominent, or your horse's lips are very stretchy and you've got a bit where it's going to run up the cheek piece like this, don't start with two wrinkles in the first place, because you're going to easily run it into the teeth. Plate bits, your French link and your Dr. Bristol. So again, these are fairly old-fashioned design now, and it's actually been banned in some of the disciplines now, plate bits, because of the levels of pressure they can create on the tongue. The French link looks like it sits flat. It doesn't. See, when you look in the mouth, it sits on the thin edge. And the Dr. Bristol, when you look at the original patent, which is from 18 something, I can't remember what, but you can look up the patent design from Dr. Bristol, who designed it, and he went to great lengths to make sure that when it was fitted correctly, the plate laid flat because it was angled. And somewhere along the line, that has been lost. And these have been banned for a while, and French links have been allowed, but French links have been moved out of competition use going forward. I think it's that, or should we say, plated bits are starting to be phased out. So these French links are probably going to be starting to be phased out as well because of the high pressures, because the thin edge sits on the tongue. Hanging cheeks or Yorkshire bits, as this one down here, give pole relief. Again, the traditional thinking is that you create pole pressure because it has a shank, but again, the shank is above the mouthpiece and not below the mouthpiece, so you can't get any leverage on this bit. So they actually reduce pole pressure, and again, this has been proven. Shaw did some pressure testing on different ring actions, and the Yorkshire ring action reduces pole pressure by about 10%, basically, and that's because it has a lifting action in the horse's mouth, so it reduces your pretension on your cheek pieces further. So again, what action do you get off these? The mouthpiece is suspended in the horse's mouth, it's suspended off the bars, it's suspended off the jaw, so you get the little jaw pressure off them, you get some pole relief on them. Depending on the mouthpiece design, you may get some tongue relief. So they're fairly subtle in their action potentially. So if your horse is going well on it, it's probably because it doesn't like a lot of pressure. If you aren't getting pole relief, and the pole relief comes often through, you will see the cheek pieces bag slightly as the bit lifts and rotates in the horse's mouth on rein contact. Sometimes if people see that, then they think the bit's sitting too low and they'll lift it. Basically, it's the usual thing, they'll lift it to stop the cheek pieces bagging slightly on rein contact. If the cheek pieces stop bagging on rein contact, it's usually because the actual mouthpiece is then sitting on the teeth, it's sitting on the premolars, so you've lifted it too high. That's the only time it stops being able to rotate and cause the pole relief. So again, where you fit that and how it's fitted is quite critical to how it works. And the mouthpiece, because it sits up on the cheek piece, the mouthpiece, it generally sits higher in the mouth than an Egbert snaffle or the snaffles anyway. So be cautious about actually fitting it too high and it ended up on the horse's teeth, particularly if your dentist has noticed some bit wear and things. Gags, ported bits. Yeah, they give tongue relief. This is a ported bit, obviously, has a raise in the middle, various designs, various shapes. Does the port fit your horse's mouth, or is it going to impede on the roof of the horse's mouth? That's something to consider. How is it angled and how does that change on rein contact? Again, often marketed, this is a bomber bit as a happy tongue bit or something like that, which sounds like a happy thing to use. All we're creating is bar pressure, basically. So while they may be a happy tongue bit and that they give tongue relief, you're putting pressure elsewhere, and you're just transferring pressure to the bars, the lateral edges of the mouth, the lateral edges of the lips often. And again, if it's on a fixed ring like an Egbert snaffle, then again you can create pretty high pressures. And there's plenty of studies that have shown lots of bit wear damage on the bars of horse's mouth. So again, just something to be aware of. Gags, leverage bits, anything like this, again, you potentially conflicting signals. And again, variable pole pressure. So just making sure you're aware of the setup is really important. I'm going to say things to avoid. You'd hope to avoid the left-hand picture, but that's a picture from FEI Global Champions Tour show jumping. So that's allowed, fortunately, as we currently stand in FEI competition. But I'm going to say first, changing the bit frequently, which is something some people sometimes happens, and some companies actually encourage, or some approaches the bit and actually encourage to change the bit frequently, so the horse doesn't get used to the bit or doesn't get, um, shall we say, dependent on particular pressure points. Some people phrase it, but I think if you are changing the bit frequently, then I'd be always asking why are you needing to do that? Because there's something going on that you're missing, or something going on in the horse's mouth that it's not happy with usually. If you're constantly having to sort of cycle through different bit designs, there's something that's not working somewhere. So I would be stripping things back and having a think about what's going on. Complicated mouthpiece or setup. Yeah, obviously in this picture, there's all sorts of things going on here, which we may be getting mechanical advantage here, but I'm going to say you're not getting control. If the horses are always going to run through it if they want to. So the more we're getting into this sort of thing, whilst it's an obvious welfare problem, you'd hope would be obvious, but the more mechanical advantage you're trying to obtain, again, we're missing something. And horses are flight animals, so if we're creating more and more tension, you'll create more and more flight response potentially. So at some point, where does it stop? It becomes a huge welfare issue. So again, just going on to that, again, strong horses and requiring a strong bit, you've got a flight response. So if you increase tension, you increase flight. Is it a balance problem? Is it a lack of understanding? Is it a training problem? Is there no clear aid or release? I'm going to say, where's the aid and release in that? Who knows? Is it an appropriate fit? Is it an appropriate use? Or is it simply the horse is excited? Yeah, you're out hunting, all the horses are galloping. Yeah, it may well be strong. But there's a few things to think through if your horse is strong before we go to necessarily changing the bit, although the bit may be required a change. Or certainly before we go up in the bit design. Usually, most horses that I see will fall into the first 3 or problems there. So if I go to see horses that are strong, it's usually one of the other issues going on. And if we solve the other issue, then a lot of the strong, shall we say, the apparent strong behavior goes away or improves significantly. And the horse becomes a lot more rideable. So working through these things first is probably the most important thing. Excessive salivation, again, often thought to be a good thing potentially if your horse has got a lot of saliva, but it's suggestive that there's some sort of physical or psychological restriction to the swallow mechanism. Yes, all horses are producing saliva all the time. They don't walk around the field with it coming out of their mouth in general. They should be able to swallow it. So if they can't, or it's happening very quickly, it's a combination of something preventing the swallow mechanism from working properly. So it's either a combination of the bit, the nose band, the rein contact, the head angle, restriction of the jaw and tongue movement. So those things need addressing, ideally, so the horse's normal physiological functions can carry on while you're riding. Blue tongue, yeah, we've already mentioned, it's very topical at the moment. I've seen it with both snaffles and doubles, with and without rein contact in the stable. You need to look for it though, because it's not always obvious and the horse doesn't always open its mouth. And like usually during the course of looking at a horse, we'll stop, particularly if I'm seeing even fairly subtle signs of tension in the mouth, we'll stop and keep having a look in the mouth at various intervals to look for this, to look at actually what's going on with the tongue. I'm going to say it always will represent a welfare problem, because if the tongue is going blue, there is some restriction in the blood flow. A restriction in blood flow always creates a change in sensation. I'm not going to say, I've said there, pain. It always creates a change in sensation, whether that's a tingling, a numbness, pain. It depends on how an individual experiences it, and how an individual experiences pain, from human medicine, is very variable, and there's no reason to think horses are any different. But it's always going to represent a problem. So if that's happening, again, it needs immediately addressing, because cutting off the blood flow or reducing the blood flow to tissue is not a good thing. So just going through things that we'd look for in external when we're assessing for bit and bridle fit. The main thing, again, which is highlighted at the top really, is I'm looking at the relative anatomy. All horses, yeah, they've got a head, they've got teeth, they've got a tongue, basically, but it's the relative positions of their anatomy that make something work or not for them. So we look at the whole horse from the outside first, looking at the shape of the skull, looking at the jaw angles. Arabians are quite difficult to fit, potentially, particularly if you've got a bit that is designed to rotate in a particular way, because their lower jaw angle and their upper jaw angle are often quite different due to the dishing on the face. And so as the lower jaw comes in to meet the upper jaw that comes where the bit sits, again, though, how a bit works, if it's designed to rotate in a particular way, can be very variable in these sorts of horses. The other thing that I pay particular attention to and is becoming much more prominent with bridle fit these days is how the nuchal ligament, the pole, joins the back of the skull, and whether you can palpate the nuchal ligament easily, where it joins the spine and the occiput at the back of the skull. If you run your finger over the top there, even if you've got a bridle path, if you can still feel a ridge there as you run your finger over the top, you're probably feeling the ligament there. And if your horse has got that prominence there, having a bridle headpiece that has space in the center will undoubtedly make it more comfortable. We've been having this idea for years with saddles. You put the saddle panels either side of the spine, you leave the spinal ligament clear. This obviously is a continuation. It's the first part of the spine and the first part of the spinal ligament. So leaving that clear always makes a difference to these horses that have that prominence there. So, i.e., alleviating some pressure on it. And again, there's different bridle designs now that can alleviate pressure in different ways. That's something to pay a lot of attention to. The other thing is the ear cartilage, which is really important at the angle of that. And the headpiece fit and design has been shown in studies to have as much influence on the horse's movement as the saddle. Actually, when they've looked at studies of how it can change the biomechanics and the stride length and things. So your headpiece fit is really vital to having a good look at your horse's head and how your bridles fit in. And we'll talk a bit more about that around this area is pretty vital. Again, the TMJ, the temporomandibular joint, this is where a lot of proprioceptors are, so joint position sense receptors. And again, you can create a lot of tension in that area and changes in balance if the bridle's plate or buckles are digging in this area. We're going to talk about the hyoid bone, its connections a little bit. But again, the other thing I look at is the thinking about how bits rotate is where the corner of the lip is and where the bottom of the molars are, and you can feel those easily, and you can have a look at the distance there. If you've got less than an inch there, I'm not going to fit a Cake Ultra because I know that they move in the mouth a lot, and they can move over an inch. You're also probably not going to fit a horse like that with 2 wrinkles to start with because it's already going to be putting pressure on the lips. So yeah, and again, we're looking at general muscle development and any other abnormalities and general conformation, overall muscle development, their back, and also their foot balance, because it all has an influence on how the horse is going to move. So in looking inside the horse's mouth, again, the main thing is the relative position of these structures and how they are going to interact. And the other thing that which we've mentioned when we're looking at the horse's tongue is this part of the tongue at the back. This is called the torus lingua, and it's part of the tongue that helps push food against the hard palate and helps move food up the mouth when they're eating, and so it's also part of the swallow mechanism. In some horses, this torus or bulge, as you might see on the tongue, actually sits around about or below the level of the teeth. So again, a good reason to have of the premolar, so a good reason to have a look in your horse's mouth and actually see if you can see this. Because lots of horses where they may have tried 20 or 30 different bits and the horse will never settle, or it's always moving its tongue. Actually, it's the bit is touching this, and it is part of it. It's almost an involuntary mechanism, involuntary movement for the horse. If something touches it, it will move it. As I say, it's part of the swallow mechanism. So the trick with those horses is you need to find a bit that's not going to touch it, and they'll usually settle. So yeah, we're looking at the relative positions. Have they got wolf teeth? Ideally, I'd want them removed. Have they got canines? If they're a male horse, even if they're a female horse, 20% of them have canines. So are they there? Width and shape of the upper palate. Again, if we're thinking of a ported bit, some horses have a very flat palate, some horses have a very arched palate. How much room have we got? That may be, if they've got a very thick tongue, the room may be in the palate is maybe the only room that they have. So you may want a bit that actually does arch forward into that area because it's going to allow some relief off the tongue. The tongue is the only conformable structure in the mouth. It's a muscle. It's the only bit of soft tissue that's conformable. So if the bit design doesn't fit their anatomy very well, then you're going to start putting pressure on there. And as a basic aid, your tongue pressure is a stop aid. So you've already created a stop aid before you've picked up the rein, essentially. Looking at the lips, looking at the corners of the lips, looking for any injuries, looking at cheek flesh, are the things that we, again, will be looking for. And again, just talking a little bit about mouth conformation in general. The bits usually sit in the narrowest part of the jaw. Again, you can see in this horse, as in the picture previously, that torus lingua is about where the bit's going to sit. So we need to be careful about that. The average distance between the upper and lower bars is, in some horses, 24 mil, and that's been measured on skulls where there isn't any flesh or any soft tissues in there. So again, a very thick bit, a 20 mil bit in some of these horses, the horse will be barely able to close its mouth around it. So the bit thickness becomes vital for those sorts of horses. As we said, the upper palate is maybe the only part that allows room really for the bit. So talking again a bit more about the hyoid bone, and presumably most people have heard of this these days, but not everybody, so don't worry if you haven't. But it's what attaches the horse's tongue, the tongue being a muscle at the end of the day, to the rest of the horse's body, essentially. And once we start putting a bit in the horse's mouth and interacting with the horse's tongue and jaw, then these structures and these connections become vital to how the horse works, and whether it's going to work happily or not, or whether it's going to use its other muscles appropriately. So the base of this, so this is the hyoid bone. It's in 5 parts, made up of 5 parts, and it attaches onto the inside of the temporal bone up here, so it attaches onto essentially the jaw joint, and it hangs down. It's a very delicate structure, and part of it surrounds the airway that supports some of the soft palate for breathing. And at the base of it, there's a little projection in the center called the lingual process, and that's where the tongue attaches into. The tongue comes all the way up and attaches into the base of this bone. And then off the back of the bone, there's muscles that attach the sternohyoid that attach down onto the horse's sternum, so the breastbone, the center of the rib cage, and also muscles, the omohyoid, that attaches down onto the fascia between the scapula and the rib cage. So these muscles then start to have an influence on the horse's thoracic sling and how it moves its rib cage, basically. The action of the omohyoid muscle is to retract the hyoid. So the hyoid hangs off the temporal bone and it can be moved. It can swing backwards and forwards slightly. So if they contract the omohyoid muscle, the horse, it will move the hyoid and therefore the tongue back in the horse's mouth. So if your horse, I'm going to say, if you have a bit in and your horse doesn't like that bit for some reason, it's retracting its tongue, or that bit's touching the torus, bulge on the tongue, one of the things they often do is retract the tongue to avoid the pressure on it. It has to contract the omohyoid muscle to do that. And as soon as it starts to contract the omohyoid muscle, it will then start to contract and shorten its neck. As soon as it contracts and shortens its neck, it starts to put some tension through this, which then influences how its thoracic sling is going to work. So you then start to get a limitation in how the rib cage will move, and how the back will lift. So the horse can block itself from the front simply because it's the bit's touching the torus, basically, and there is nothing you can do about that as a rider. There's nothing you can do about that unless you change what's in the mouth, and the horse can relax its tongue voluntarily. So that's one of the most important connections through the horse's body. The thoracic sling obviously goes into ventral chain of muscles, the ventral myofascial lines, the rectus abdominis, the iliopsoas, and all the way down to the hind toe. So you can literally block the back end, you can block the hind leg from the front end. Equally, if there's problems further back in the horse, it can reflect in the tongue being or their mouth being unsteady or contact. So this can work both ways. So tongue issues often can equally 50% of the time not originate in the mouth. So again, that's something that's interesting when you go to look at a horse who has apparent tongue issues, is what's going on in the mouth. Is the bit fitting? Is it impacting any structures it shouldn't be? what happens when the horse works, what changes when the rider picks up the rein, and then you're looking down the muscle chain all the way along, basically to see what else is going on, and where else there's problems arising. And often it can be problems in the back, and often it can be problems in saddle fit, it can be problems in the spine, it could be SI problems, it could be hop problems, it could be stifle problems, it could be anything. So, but again, we can eliminate bit and bridle issues, or the bit and bridle is an issue, basically. So yeah, and some of this is an involuntary reflex in the horse. It just creates compensatory tension patterns through the muscles, and so again, you'll get a negative effect on biomechanics. And if that goes on over time, again, the horse can create injuries or problems in itself, muscular strain, extra wear and tear, osteoarthritis, things like that. I'm sure can develop from compensatory movement patterns over time. So we're going to talk about some considerations when we're and about connection when we're introducing the bit, which I think is something Lisa we were talking about quite a lot. So always, if we're changing the bit, we're aiming to improve the welfare. Sounds obvious. Always loosen any restrictive noseband to genuinely allow the horse to show me what it thinks and show me what's going on, and allow it to mobilize the tongue and the jaw. I always want to give the horse time actually to notice the change, because it will usually, when you put a new bit in, the horse will usually give its usual response, shall we, the first couple of seconds or the first few minutes, because they're expecting a particular action or a particular pressure. And once the horse realizes a change has occurred, they will change how they react, and they are usually pretty honest to small alterations. And it could significantly change the biomechanics, particularly if we've taken pressure off that torus and the horse suddenly relaxes the tongue, and suddenly the whole muscle chain will change, and the whole way of movement will change instantly. If there's any doubt about how the horses react, introducing in hand, literally walk the horse around with a bit in and let it have a chew and a feel. Walk and halt are really useful in this. Again, just introducing that the aid will feel different, your rein aid will feel different to the horse. Before you proceed at any other gait, make sure the horse understands it, and make sure the horse's pin is responding in a different way. Looking at any other factors. We've already said how the tongue is connected by way of the hyoid apparatus to the forelimbs and the thoracic sling, and the normal physiology of the tongue is vitally important to the movement, basically. Muscle dysfunction, obviously, as well. If the muscle is continually tense, or any of those muscles are continually tense, basic muscle physiology, tension causes lactic acid buildup, because you start to develop anaerobic respiration in the muscles, and lactic acid buildup causes cramp over time. And what you don't want is cramp in your horse's tongue, or in any of the muscles around the neck and the head, their poll, their jaw. That's again also going to cause problems. Again, when introducing the use of the bit, or how to introduce the use of the bit to the horse, again, the timing of your rein aid obviously is vital. Again, I'm sure most people are aware of this, but your half halt in time with the forelimb stance phase attaches your rein aid to the horse's biomechanic action. And again, if the horse's tongue is relaxed, you get the transfer of pressure through the myofascial chain. Basically, again, the thinking is that about 40% of transfer of energy from one muscle to the other down the myofascial chain, basically. So if that myofascial chain is functioning properly, you will get a transfer of your aid to the hind leg, literally through the myofascia. And so you can influence negatively or positively how the bit works, or how the horse understands the bit, if you use it with the correct timing or not. So that's really important, your timing. Again, it's a training issue, but again, just introducing a bit to a horse, if they understand it's working in time with their biomechanic, it makes sense to them. If you're using the bit in that way and the horse is relaxed, you're also, and again, thinking from a PT point of view or a training point of view, you're also indicating to the horse at what point in their gait they should be engaging particular muscles, because you start to send that signal down the myofascial chain into the thoracic sling. So you're signaling to the horse at what point they should be activating in the biomechanics, that muscle chain. And when we get on a horse, we unbalance the horse always. by sitting on their back, and they have to learn how to balance with us. And part of that is engaging those muscles they wouldn't necessarily engage walking around a field. So we can literally start to activate those muscles and indicate to the horse how to balance us if used with the timing. But that's only effective if the horse is relaxed and that muscle chain is working effectively. So again, that's something where the bit becomes a lot more subtle. It's not a break. It's not. We start to really use it in a subtle way, which is good. I'm going to have a quick whiz through, if I've got time, Lisa, on a bit of anatomy for bridle fitting, and talk about the nerves, because again, some of the things that a lot of the bridle manufacturers talk about is facial nerves. So just to clarify a few things there and what's important, so you can pick out whether your bridle's fitting well or not. But the main nerve that supplies sensation to the horse's face is your trigeminal nerve, again, often associated with head shaking issues and things like that. The trigeminal nerve splits into 3 branches, indicated in the areas in the picture at the top. Yeah. And it's a sensory nerve in general. So sensory means it provides pain, touch, temperature, sensation to the skin, the face, the eyes, the sinuses, the mucosa, the nose, the mouth, and the teeth. So everything on the skull, really, and inside the skull. And the first branch comes out by the jaw joint and supplies the front of the face, the eye. We call the ophthalmic branch. The second branch comes out of is this branch here. It passes back into the skull and then it comes out just below the facial crest through the infraorbital foramen. So really where your noseband sits. So this is where, again, some bridles are designed to try and avoid pressure here. And some grackles, micklums, things like that, trying to avoid pressure on this infraorbital foramen, this nerve here. And that is important. That supplies the side of the face and the upper jaw and the teeth. The third branch, though, is probably the most important, is the mandibular branch. Again, it passes into the jaw, comes all the way down and passes out of the jaw again, a little hole down here called the mental foramen. And so the final part of this branch is external here on the skull. So this is really anywhere where your flash drop, micklum, grackle, anything with a strap below the bit potentially sits on this nerve here. So it's one that a lot of the manufacturers don't like to talk about very much, but it's probably the most important part of this. This supplies sensation to the whole lower jaw, the teeth, the tongue, the bars, everything the bit acts on. And this part is not just a sensory nerve, but it's also a motor nerve. So a motor nerve, provides also movement to the jaw muscles. So it's probably the most important one. So again, if we can avoid a strap down here, it's all the better. And again, there's been various things about pressure testing on straps down here. And some claims that there isn't much pressure down here, but we can say if there isn't a strap there, then you're definitely not causing pressure on that. So if we can avoid it, then that's best for the horse. The facial nerve, which is what a lot of the manufacturers talk about, and they provide sort of scoop back cheek pieces here and things like that to avoid pressure on the facial nerve. The facial nerve is superficial, but it is not a sensory nerve, it's a motor nerve. So even if you touch it, the horse can't feel it. So it's probably not that relevant. It provides movement to the horse's muscles of facial expression. So if your horses are pulling a face, that's the facial nerve working. But again, the pressure down the inside of the cheek pieces is pretty negligible when they've tested it. So avoiding this is not that relevant. I'm going to say, stick that out there. It's not that relevant because the horse can't feel it anyway. It's not the sensory nerve. It's the trigeminal nerve that's the most important one. It has some special sensory things, but it's a taste sensation. So again, it's not a pain. It's not a feeling. It's a taste. It provides taste sensation to the front of the tongue. But that's, again, that's a different thing. Bridle fitting, again, should be like saddle fitting, i.e. fitted to your individual horse's head. And again, the research now shows that, as we said, the headpiece fit is as important as the saddle fit in terms of the horse's movement. There's lots and lots of anatomical bridles on the market now. Anatomical, we simply mean a monocrown headpiece that's curved or angled in some way to fit around the horse's ears and poll area. Again, this is a particular example of an anatomical headpiece that I'm going to say doesn't fit this horse well at all. What I'm looking for We start at the top. Is the headpiece sitting flat? So is it distributing the pressure evenly in the way it's designed to? Is it giving a curve around the ear? Not quite. It's sort of curving into the base of the ear here. So that's not great. And then the final thing I'm looking for is the angle of the strap coming off the headpiece, running in line with the jaw so it balances the bit. Is it running down to meet the corner of the lip, the same angle? This obviously is not going to, although you can't see the full picture because the horse's jaw angle is here, and this is obviously here. So that headpiece doesn't fit that horse. If you attach a bit to this, it will rotate the strap forward, which will then start to tip this onto the back edge. So it's not going to sit balanced, and it's not going to distribute the pressure evenly. And it's also going to bring this part forward into the ear. So just because it's marketed as an anatomical bridle doesn't mean it will fit your horse. It still has to fit your individual horse's head. So that's, again, something that can catch people out easily. While they're trying to do the right thing, it may still not be fitting very well, and therefore not working as well as it could do for the horse. So having said that, there's no single design of bridle that will fit every horse. So whatever your manufacturer says, not every design will fit every horse. They all cause pressure on facial structures in some ways. And again, one of the things that we would say is that a tight riding hat will give you a headache. Glasses pressing around your ear cartilage give you headaches. There's no reason to think that pressure here for the horse has any difference. Again, you have the same nerves as we do. Brow bands are often too short, and where the buckles are placed, like in this picture, up on the bony area. Again, ideally we want buckles down at eye level to avoid any bony structures or anything digging in the edge of the bone, the jaw. And then thinking about noseband fit and purpose, and we'll talk a bit about that again. But the areas of peak pressure on any headpiece has been measured actually to be behind the ear, and then we have the atlas, where the brow band attaches, and in the centre of the poll. Again, with traditional hunter design, where you have the thin cabeston strap running underneath the headpiece, they have a really high peak pressure point at the poll when they've measured it on research. So again, if your horse has a prominent nuchal ligament and you've got a traditional cabeston or traditional bridle design on, then changing that headpiece will make a massive difference, because they create a really high peak pressure there, and the nuchal ligament will be taking all the pressure, which is the first part of the spinal ligament. So again, if you want your horse to relax its poll and work over its back, the whole spine needs to be clear. So yeah, again, a lot of this pressure testing has been done in trot, but the fit and design of the headpiece and the brow band can directly influence the trot stride, and the force changes with a maximum force at 75% of the stance phase. But you can, as I say, get very high peak pressures, which will change the knee and the hock flexion. Wide headpieces create more pressure on the atlas. As we've said, if the noseband straps running underneath, it creates high pressure at the poll. Rolled bridles, which are popular in for dressage and things, pressure testing there were the worst because of the asymmetry, all the buckles, and the pads and the amount of straps running over the top creates massive changes in pressure. So again, if you're looking for refinement in your horse's movement, avoid, basically. Noseband crossing over the top where it's threaded through, again, you carry a pressure point just at the base of the ear. And yeah, more padding doesn't necessarily reduce pressure, and it can affect the position of the bit. And again, ear veils have been tested, and again, where they're very fancy or they've got a ridge, a braiding around the edge, again, they create a high pressure at the base of the ear, at the top of the TMJ. So if you're putting anything underneath, which is quite popular these days, ear veils or fly masks or anything like that, then again, just make sure, ideally, it's as plain as possible, and it's not changing the headpiece fit or indeed the bit height you may need to change. Basically, so what would we recommend? A monochrome headpiece that fits your individual horse's head shape, basically, ideally with some poll relief in the center, and is fitted around the horses and conforms, shall we say, to the horse's ear cartilage in a comfortable way. So again, a few different anatomical headpieces, and you can see why they're not all going to fit from what we've said. So you could buy 4 or 5 bridles and still find one that doesn't fit your horse well, unless it's been fitted. Again, another bridle design that's designed to be scooped back, avoiding the facial nerve. But again, when we have rings like this, again, and the cheek piece doesn't attach directly, then again, it can affect the bit action. So again, if you're wanting a particular bit action, if you're wanting to utilize pole pressure or pole relief from your bit action, if you've got a ring here, or like a Micklem has a strap, again, you're going to change the bit action because you're not going to directly influence the pole or get pole relief due to this ring. So that's something to think about. The bit and the bridle work together as a component unit, and they both have to be working effectively. So noseband fitting, obviously, there's a lot of controversy at the moment around tight nosebands, which we're going to run through really quickly. This green implement is the ISIS taper gauge. The International Society of Equitation Science developed this taper gauge a number of years ago to give a standardized fit. And most of the studies done on noseband fit in recent years have used this as a standardized fit. So it is available to buy. If you wanted to, it standardizes, shall we say, a 2-finger fit and a 1-finger fit. Obviously, in general, with the noseband, whatever design, it should be sitting clear of the facial crest. Again, you get high pressure over bony ridges. Where the nosebands cross the bony ridges, so on the nasal bones and the chin bones, you get higher pressure areas. Some new research that again that's been published this week has shown actually most of the pressure is on, there's more pressure on the mandible, the lower jaw bones than on the nasal bone for most nosebands. Yeah, and again, drop nosebands are difficult to fit, and we've got to make sure the drop part is not sitting too low on the very delicate nasal bone or impeding the soft tissue of the nasal passages, so impeding breathing. So some quick information about tight nosebands from different studies. They can obviously, the tighter the noseband, it pulls the headpiece down, it causes restriction potentially across the poll and the headpiece, so can adversely affect how your headpiece will fit and therefore impact the biomechanics. They have the potential, as we said, to impact nerve function in 2 places. And as it crosses the jaw, can also increase the risk of internal cheek injuries if it's pressing the flesh into the premolar teeth, or you've got sharp teeth there or dentition. They've been shown to increase the sensitivity and severity of any bit, obviously because the horse can't avoid the bit if the noseband is tight, and if there's any issues within the mouth, that's going to increase problems, and it can also affect rein tension and how the rein is used, and again, that's been shown on studies. Restricting the jaw obviously reduces the horse's ability to chew, swallow, and relax, therefore, as we've said already, will affect the movement and balance. Being shown to create a stress response with increased heart rate and eye temperature, which correlates with cortisol levels. Cortisol is a stress hormone. They have been shown in studies, again, published studies, to exceed the pressure of tourniquets and therefore restricting blood flow to the horse's face. And that can occur even if your noseband is at 1-finger tightness. And this particular study was looking at relation of bitless bridles in relation to bitted bridles. And so bitless bridles, simple side pulls tend to have to be fitted tighter so they don't spin around and they are effective, but they showed really high peak pressures on them. Yeah, again, there's a large study done over 3 international, over 3 countries with over 1,000 horses in, looking at noseband tightness and the risk of oral lesions and oral injuries in the corners of the lips, and that was looking at all disciplines, and regardless of bit design and bit fit. And again, tight nosebands increased the risk of injuries. I mean, no noseband actually increased the risk of injury as well. They thought that was when they were looking at endurance horses and things, and they thought that was due to some instability in the bridle because the noseband helps stabilize the bridle. But a loose noseband, and when I say loose, fitted at 2 fingers, reduce the risk of mouth injuries. So if you're going to use a noseband again, that's something to consider. And again, a bit of new research that's been published this week, which some of it would hope you'd think is obvious. Pressure and force increase with tightness of the noseband, which should be obvious. Anything less than 1 fingers for all nosebands created significantly high pressures on the nose and the mandible, the lower jaw. But again, it increased more on the lower jaw, actually. They looked at the cavus, the crank noseband, flash noseband, and the drop noseband in this recent study that's been published this week. They said there's no statistical difference between the pressures on the cavus and a crank noseband. However, when you look at the data, the pressures were lower in the cavus, which, while it wasn't statistically significant, could represent significant clinical significance, shall we say, in an individual horse. And one of the things we think about in medicine is the difference between statistical significance and clinical significance on the individual. Drop noseband showed the lowest pressures in the study, interestingly, on the nasal bone, but they didn't actually measure the pressure on the lower strap of either the drop noseband or the flash. So it was an incomplete measurement of pressure. So they've concluded from it that the drop noseband creates the lowest pressure, but as they didn't measure the whole thing, I'm not quite sure how that conclusion is at all valid, because it's incomplete data. There's tourniquet theory that's been shown in this other published study about high peak pressures, and their thinking behind that was that the pressure changes through the stride and trot, so their level of high pressure is not always the same, and a tourniquet has to exert continuous high pressure to cause a problem. But actually, again, when you looked at the data, certainly on the tight nosebands, they were measuring pressures, average pressures above that, of which you'd need to include capillary pressure. So your average pressure is above capillary pressure, you're going to create flow restriction, even if it's varying. So I'm not quite sure how they conclude from it that it's not acting as a tourniquet potentially. So again, we just got to be careful about how data's interpreted and represented sometimes. As we said, a bit about bitless bridles and combination of bits, they all put pressure somewhere. So the cross under designs, again, the study that looked at the tourniquet, that looked at the pressures, the other thing that they came to, the cross under design, actually noticed that it markedly increased the horse's, the angle of the horse's jaw, the opening of the, shall we say, and increased the tendency to have a more hollow posture. So again, biomechanically not very helpful if you're wanting to develop the horse's back. And combination bits put pressure everywhere. So a few quick wins if you're thinking about your horse's welfare. Have a look at the mouthpiece. Have a look at the mouthpiece choice. That's the first thing. Check there's no damage on it, or anything that's going to any bite marks, because if there is, it's getting in the teeth and that needs addressing. Watch it. What's your horse's response when you fit the bit and bridle? What does it always do? Why does it always do it? Look in the horse's mouth. That's the first thing. What does it look like? Check your headpiece. Literally, just put your hand under the headpiece, fit for tightness, and have a look at how your noseband's fit in. If we're coming to look at your horse, this is what you should expect. And this, if you're having a horse assessed, this is really what you should expect in terms of a bit and bridle fit. And then we look at the whole horse. We do a stable assessment. We want to know about what's going on. We take history, and we look at a written assessment, and we assess the whole thing from start to finish, and hopefully improve things. There's a few references. Any questions?
I know somebody, Belle, had put in about D rings and loose rings. I think there was something on the chat came up, James. That was.
Well, I can't see the chat. Tell me how to.
Hang on, I've got
the chat.
Down here. Question for later: loose ring, D ring, egg butt.
Okay. Loose ring, D ring, egg butt. They all have zero pole pressure and zero influence on the pole, so neutral in that respect. Your D ring and your egg butt are very similar in that they're a fixed ring essentially, so they are similar in how they influence the mouthpiece. Obviously, the difference with a D ring is that you get a straight side, so it gives you a little bit of steering effect because it creates more pressure along the side of the horse's cheek. So again, often promoted as good for young horses. Essentially similar to a full cheek snaffle. I would prefer a D ring because there's less risk of injury or catching on things than with a full cheek where you can hook on things. In terms of your loose ring, the mouthpiece is movable, so it has some release. So as you pick up the rein, the mouthpiece slides. The horse can also move the mouthpiece and put it into a particular position in the mouth. So some horses will certainly prefer this. It obviously creates a little bit of instability between the rider and the horse, shall we say, or the rein aid and the horse. But some horses like that release and being able to that slight release of pressure. and obviously that's beneficial to some horses. Some horses don't like the movement in the mouth and will want stability from a fixed ring with a D ring or an egg. But when you pick up the rein, where that mouthpiece ends up is essentially, should we say, fixed in the mouth. So there isn't there is stability there. If there's stability, potentially there's also something to lean on. So again, in terms of the horse's balance, or if it is leaning, or if it's in a place that the horse isn't comfortable with, then you'll start to get an into pressure response or a lead-in response. Usually horses are into pressure animals in general, and if they don't like it, they will push on it. So again, if your horse has a tendency to lean for whatever reason, then changing it to a loose ring will reduce that tendency anyway, because the mouthpiece slides. So it'll always relieve that a little bit. So there's reasons for or not using either, depending on the horse and the rider and how it's working for them, or what particular issues that they're dealing with at the time.
Anybody else? I know I'm going to have to sharpen up my half halt timing.
You what? Sorry, yeah, half halt timing. Yeah, it works really well. If you half halt when the leg is when the leg is in stance phase, basically.
I've always used it for turning. I've always turned when it's coming off.
Well,
But
yeah,
I have to know. I'm
yeah. It does start to turn the horse from the outside rein, obviously. If you're using the outside shoulder, which ideally you should be. But again, I think from a, as I said, almost from a PT training point of view, as I said, as soon as we get on horse, we unbalance it. When and the horses don't know how to balance themselves necessarily, they start to do all sorts of things, fall out the shoulder and things. And literally, if the muscle chain is working properly, you can give a tiny, tiny ring finger movement aid in time with that, which just indicates it's activate this muscle now, activate this muscle now, and it starts to indicate to the horse when to activate the muscle for balance. And it's amazing how quickly it makes sense to the horse, actually, and then the bit starts to make sense to the horse in an entirely different way, and they start to understand, shall we say, the function of it potentially, rather than we put a bit in a horse's mouth, it has no idea what it's there for. Yes, we think it's a brake, we think we're using it for steering, it's sort of obvious to us, shall we say, in our mind, we have an idea of what it does, but the horse has no idea of what it should do or why it's there really. But actually, if you do use it in time, it can activate those muscles in a helpful way. It suddenly becomes very, very subtle and very, very interesting for the horse, and they start to, I'm going to say, they start to attach themselves to it. They seek it. They want to reach for it, because you're helping them with balance all the time. And every time you put the horse into balance, horses like balance. They don't want to fall over. They're flight animals. They want to be in balance. So they realize very quickly that it's helping them. So it's a really effective thing, actually. A lot of people do the timing without realizing that they're doing it. And a lot of people will get the timing right through feel without realizing that they're doing it, or why it helps, why it's working so well. But knowing that in your head means that you can use it in a particularly purposeful way, potentially.
Yeah, absolutely. Because funny, mine there has obviously we have issues with thoracic sling, and I've been working behind the vertical, and yeah, that's definitely going to be another trick I'm going to try for sure. I'm back out tomorrow in the arena.
Excellent.
Well, I think if nobody else has any questions, is there another question? No, I've been reading through that. It's fine. I'd just like to thank you so much. It's just taking bidding to another level. Definitely just thinking about it in a completely different way. And I was horrified to hear about not that I've used my universal gag, but horrified. I think I thought by not using the chin strap that I was doing my horse a favor, but that would have been 20 years ago.
Yeah, you'll probably do more of a favor to use the chin strap. But again, it's just knowing that you can set it up in different ways, basically. Yeah, it's important. But again, when you buy one, they don't give you the information, even though the information is out there, and most of the manufacturers that make them have that information. It would be useful to have a picture on their packet showing you the options and how it affects the horse.
Absolutely. absolutely. No, well, thank you so much, James, and hopefully we'll get you organized to come over when you find a spare couple of days.
Yeah, I'd love to.
There's quite a lot of it
Thank you for
over here for you to come over anyway.
thank you for inviting me to talk, and thank you for listening, everybody. Hope it was helpful.
Yeah, no, we're getting lots of thanks for that. So yeah, I can see it our end anyway. So thank you very much.
Great.
Bye, everybody. Have a good night.
Take care.
See you.